I graduated Yonsei Medical School and I was trained in Assam Medical Center. I'm a pediatrician since 2000. I have met around 2 patients of Duchenne Muscular Dystrophy, and in Zimbabwe, I have met around 2 patients. Zimbabwe is located in southern Africa, and this country is now surrounded with a very serious economic problem, and consequently the medical condition is very down now, and the social welfare system is established, but the economic support from government is very poor now. The Duchenne Muscular Dystrophy is diagnosed by muscle biopsy and genetic study, and the most cases are diagnosed by clinical manifestations such as calf muscle pseudohypertrophy, and the Gower sign is the very diagnostic value. Well, number 4 question. I can't say there is difference between DMD patients in Korea and the DMD patients in Zimbabwe, because the ultimate treatment modality is not established. So corticosteroid and physiotherapy is now only we can do for that kind of patient. So I think it's almost the same. And number 5 question, in treating DMD patients in Korea and Zimbabwe, were there any differences? I think it's much the same, but in South Korea, the rehabilitation therapy is well established, so they are being helped by physiotherapy, and they are receiving corticosteroid therapy very regularly. And although this treatment of this modality of treatment, their quality of life is very poor. So after 5 years, they are having some difficulty from lying position to standing position, and they can't walk well, and even the respiratory muscle is involved. So ultimately, final stage, they have some respiratory difficulty, and the quality of life is very poor, and their daily life is very, very serious, and they're very poor. So in Zimbabwe, most parents are giving up the treatment, and they are just waiting for the final consequences. And number 8 question, it's quite a brand new treatment modality of Duchenne Muscular Dystrophy, genetic therapy, and the other treatment modality. We can't afford to provide this kind of therapy because it's very expensive, but I think this research attempt and research effort should be honored, because because of this research effort, they could have some hope, and we must find out the ultimate treatment of modality. And number 9, do you think these approved medicine help? Well, I think the other area such as mucopolysaccharidosis or other genetic diseases, they are being helped by genetic therapy. So I think if this kind of research is going further, definitely it can be succeeded. Affordable price in Zimbabwe, it depends on the supporting fund, and it depends on the medical institute situation. So I can't say how much is affordable, but the price is not the problem. Actually, if we can do research for this kind of very difficult disease, we must do, and we must go further for the patient. What is the best we can do for now for the patient? Until now, the corticosteroid therapy and the physiotherapy is we can do for the patient.